Welcome back to the Black Health Lit podcast. This is a space where we can be Black, proud, and healthy. As a reminder, the information shared here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. While you're here, check out the episode description to learn more about today's guest and shop Black, Proud, Healthy merch. When you shop merch, you're helping to support future episodes and free health education for the Black Health Lit community. Lastly, make sure you like, subscribe, and share this episode. All right, welcome back to the Black Health Lit podcast. Today, I am talking with Janelle King. We are talking about reproductive and sexual health and body literacy. Before we get into this topic, can you introduce yourself to my audience?
Yes. Hello, everyone. My name is Janelle King. I'm a registered nurse. I've been a nurse for, I think, over 10 years now. I've been a nurse in a couple different areas, reproductive and sexual health. I have worked in cardiology. I have worked in college health. I'm also a public health professional. Before I became a nurse, I worked as a public health professional, actually in Columbus, Ohio. I used to work for the Ohio Department of Health in a couple different areas, maternal and child health, as well as heart disease and stroke prevention. So that's what I do with my time. I spend my time talking about reproductive and sexual health and just helping people understand their bodies a little bit more and what that means when it comes to reproductive and sexual health.
Yes, I love it. Somebody has to do it. So let's jump right in, Janelle. How does reproductive and sexual health uniquely impact the well-being of Black women?
So, like your regular physical health and like mental health, reproductive and sexual health affects your quality of life. So, unfortunately, the United States has a shameful history in regarding forced sterilization and reproductive injustice when it comes to Black women. So that, as a fact, leads to a lot of Black women being just distrustful of the medical care system, of healthcare providers, of contraception, some different contraceptions when it comes to reproductive and sexual health. And so this as a whole contributes to a lot of the, unfortunately, the disparities that we see in health outcomes.
Okay. What would you say are some special considerations that need to be addressed within the healthcare system?
What doesn't need to be addressed?
I know, right? Maybe top three.
Top three. Okay. So within the health, so one of the things I think it's important for providers to recognize their biases and how that can play out, specifically when it comes to reproductive and sexual health. So like any individual, we have certain biases to, people we see and stuff like that. So unfortunately, this can result in, or it can impact clinical decision making. So if you see a Black woman and you're thinking, this is a Black woman, she probably has a lot of kids, you may inadvertently, subconsciously, push her towards a certain birth control method that she may not want, or not diagnose or not take her symptoms seriously when she could in fact be presenting with something serious. So it impacts, it's bad, and it impacts the care and the quality of the outcome for Black women.
Yeah, for sure. So in the introduction, I talked about how we were going to cover body literacy. Let's level set and define body literacy. That's a new one for me.
Yeah. So body literacy is just understanding your body, how it works, understanding your quote unquote normal. So everybody's a little bit different. And in terms of the way your body functions or what helps your body is going to be different from everyone. So you have to understand kind of what works best for you in your specific situation, for your lifestyle, and recognize that may be a little bit different than what works for like your best friend or your mom or your sister.
Okay. So an example could be, let me think of something. When I went through a health event I realized every time I went to the doctor, my temperature was below 98.6. And after about 3, 4, 5, I don't even know how many visits, um, it became the normal that I ran around like 97.3. Which at the onset was like, what? But then it was consistent, no signs of infection, blood
Right.
works great. I just run cool for some reason. So
Yeah.
when I start to creep up, um, then I know it's a problem. So I know for me, normally when I start to creep up, maybe I won't get to 100 degrees before I'm like, whoa,
Right.
something's up. If
Something's
I
up.
start getting to high 98, 99, for me, everybody's different.
Yeah.
I know something is up.
Yes, that's not an infection for you. So for my own personal example, like my pulse is just low, like it's low, like it's supposed to be like a regular normal pulse for individuals, anything between 60 and 100, right? So anything below
Yeah.
60, people tend to get concerns. And I'm laughing because I just had a medical procedure myself a couple months ago, and so, they put the things on you to monitor and make sure everything is
Yep.
working the way it's supposed to be working. And like the alarms are constantly constantly beeping. So they're like running in there panicked because my pulse was like, I don't know, like 54. So they're like,
Yeah.
is this what's really happening? But they recognize, like, when they come in, I'm sitting there, I'm fine, I'm smiling. So like, oh, okay, so you just have a low pulse. But yeah, you have to recognize those things about yourself. Like, so what's normal for me? Like 97.3 is a little low for me, but for you, that's perfectly
Yeah.
normal, right? So yes,
Yeah.
being aware of those things and knowing and being able to share that with providers is very important. So if somebody's seeing you for the first time and they don't know that, they're going to do a
Yeah.
whole workup on you, like, what's happening?
Right.
Why is it so low? And like you presenting and saying, yeah, my temperature is 99, they'd be like, oh, okay.
Yeah.
And right. So
Yeah.
recognizing that
We got a
that's
problem.
not normal for me. Yeah.
Yeah. And it's those things that they check as pretty much at every single doctor's appointment that could be life changing or life saving if you know your normal. So, like you said, your
Right.
pulse rate, your
Right.
or your heart rate, your blood pressure, your oxygen, your temperature, those basic things. If you know you're normal and you can communicate that and your provider and give that to your provider, it can really empower them to be able to provide better care for you.
Right. And talking about reproductive and sexual health, if you know that for your periods are always, between 28 and 30 days, and you bleed for, let's say, 3 days, and for some
Yeah.
reason, for the past couple of months, you are having periods that are lasting 10 days, for you, that's not normal. And so you can present that to your provider and say, hey, I have been bleeding for 10 days every time I have my period.
Yeah.
That's not normal for me. So that would then clue them in that something may be amiss, and let's kind of do a workup to see what's going on.
Right. So let's talk a little bit deeper about that. What's the significance? I know you talked about, menstrual cycle. That's an obvious one that most of us experience. But what is the significance in empowering Black women specifically to be able to make informed decisions about their reproductive health through having body literacy?
It's very important because obviously it's going to impact your day to day and your quality of life on from day to day, and then it's going to impact like overall lifestyle and health outcomes. So it's important to, and it's kind of a shame because like a lot of, like, if you're experiencing a whole lot of pain, like ridiculous amounts of pain where you can't get out of bed with your period every month, that's, to you it may be your normal, but that's not really what's supposed to happen. So
Yeah.
recognizing that may not be normal. If you're bleeding a lot, like you're soaking through 2 or 3 pads an hour, you may be used to that, but that's not necessarily normal. So it's understanding kind of, it's two things, I think, and understanding what the normal, what they deem the normal is, recognizing that there may be some differences with you specifically because everybody's body's a little bit different, and then recognizing when your normal is outside of what's really supposed to happen. So that's important, so
Yeah.
that like you said, like it impacts your quality of life every day. Like nobody wants to be in bed for 5 days out of the month or in
Right.
constant pain if you don't have to live that way.
Right. Right. That is definitely something to know. And they typically, if you're in a certain age range, want to know when was your last period.
Yeah.
And
Yes.
so
Although
that's part of
no,
body literacy too.
right. Although a lot of people
Yeah.
don't necessarily remember. I know when I go in, I'm like, oh, I got to make a note of this because they're going to ask me this, and um, I think a lot of
Yeah.
younger people
It's,
use the apps now and stuff so they can keep track. But if you ask me off the top of my head,
yeah.
most people don't know.
Hmm. So, what are some ways that self advocacy can play a critical and crucial role in navigating the healthcare systems? So, in addition to having that body literacy,
Hmm.
now another piece of it is the self advocacy, which is a little bit different than body literacy, correct?
Right. So advocacy is, in my, how I define it is basically speaking up for yourself, advocating for your rights. So it's important because remember, you're supposed to be the master of your body. Like you understand your body the best because by virtue
Yep.
you live it, right? So these are your lived experiences. And so you have the right to be treated with dignity and respect when you're going into these healthcare spaces. So the first thing I always I teach or encourage people to do is find somebody you trust. Like if you're going to be with a healthcare provider, it's a relationship, right? Like anything else, it's a relationship. You want it to be
Yeah.
an open and honest relationship. So you have to be comfortable disclosing a whole bunch of stuff that you normally wouldn't disclose to people. Somebody who's going to listen to you and take your concerns seriously. You kind of want to make a list of the qualities that are important to you in this relationship and try to find somebody based off that. I know like word of mouth and referrals from like friends is usually the best way. With self advocacy, it's important to speak up, right? So if something
It
is
is.
wrong or you're feeling like you're being dismissed or not taken seriously, you need to voice that, right? Always voice that. It's important. Like, don't think that because this person is like the expert or wearing the white coat that they know more than you about your body. It's your body, right? So if something is wrong,
Right.
something is wrong. I give the example for myself when I just knew something was wrong. I'm like, this isn't supposed to happen. I'm just like randomly bleeding days out of the
Yeah.
month. Like I know this is not supposed to happen. And so at first they're like, oh, it's just, breakthrough bleeding. I'm like, yeah, no, they called it spotting. I'm like, no, this is not spotting. Like I'm actively bleeding. Like my quality of life is being affected. And so I made sure I followed back up. Like, no, this is what's happening. These are the symptoms. And so this is
Yeah.
before I became a nurse. And so, my doctor called me back and like, let's try this. Let's try that. Like, I think the nurse misunderstood what you said initially, but I'm glad you called back.
Yeah.
And ultimately, if things aren't working out, if you don't feel like you're getting the respect that you deserve, they're not taking your concerns seriously, don't be afraid to walk away and find somebody else who's going to care for you the way you deserve to be cared for.
Mm-hmm. Absolutely. Absolutely. And that goes back to that body literacy. If we have the body literacy, then it positions us to be able to be advocates for ourselves,
Right.
and the people around us if we have general body literacy.
Right.
Are there specific challenges or disparities that you can talk about, Janelle, that impact Black women or that Black women may face in accessing comprehensive, not just I emphasize comprehensive reproductive health care. And we may want to walk that back and talk about what is comprehensive reproductive health care.
Comprehensive, to me, my definition of comprehensive reproductive health care is it actually starts before you're able to reproduce all the way through the end of life. So like puberty to um,
Yes.
postpartum and then through menopause, right? And so you should be able, comprehensive to me is like you have the ability to access the care to meet those demands throughout the different stages of life. So whether that be, fertility planning, preconception planning, postpartum care, birth control, abortion,
Yeah.
menopause, medications. It's all, to me, that's what comprehensive is. And so, in
Yeah.
terms of addressing the challenge. There's always going to be, unfortunately, challenges. I think one of the biggest ones for Black women that we face is gaslighting. Like, there's unfortunately gaslighting that happens in the reproductive and sexual
Yep.
health space. So what that
Yeah.
really looks like is that, like, a provider who kind of dismisses your symptoms, or you feel ignored, or they kind of
Hmm.
minimize or talk down to you. So that is why it's important to understand body literacy, like we talked about, like understand your body,
Yeah.
and then be able to advocate when those things come up. I think providers, I mentioned this before, their biases, they have their own biases and what they may or may not do for you. They may push you towards a certain medication or a certain procedure when they, in fact, should be presenting you with a comprehensive list of everything that you could
Yes.
possibly have, and inform you. So you're giving you the pros and the cons of each medications or procedures, and then allowing you to make the decision that's best for you and your lifestyle. Right. So there's that as
Right.
well. Um, I think that, unfortunately, the system is built where there's like systematic barriers, right? We can talk about the healthcare, and not everybody has access to healthcare. Or if you do have access to healthcare, like, you may not have access to all services. So, or the quality of the healthcare, we have to look at that. So
Absolutely.
it's a system problem, unfortunately. So it's going to take a system like approach to address all the issues, I think.
Absolutely. I can think of a few other things. When I think of comprehensive, I also think about the wide range of services that live under the reproductive healthcare umbrella. So, whether that is contraception in the
Mm-hmm.
form of birth control pills, IUD, um, abortion
More
care,
right, morning
you
after
know,
the
morning after
our
care,
Plan B. Yeah,
access to menstrual supplies. Period
yeah,
poverty is a real thing. And like
yeah,
I could list off, I mean, literally so many things that impact our daily lives, whether you are premenopausal, post, or, actively in menopause, that are impacted and should be incorporated in our whole care, and should
yeah,
be accessed, or accessible by everyone. But like you said, you touched on it a little bit. A healthcare provider or system or even a facility may offer, let's say they offer 5 things, but depending on your insurance type, depending on what your doctor recommends, you may
yeah.
not have access to all 5 of those services, even if you need all 5.
Right. It's so,
So
yeah. You're right.
yeah, it's a little crazy. So yeah, lots of things to be done. And like you said, they have to be addressed. They have to.
Yeah, starting from, the individual through the population, they have to be addressed. And I think, like, just knowing, like, information, you hit on some of the menstrual products. Like, some people don't know that there's like reusable or longer term menstrual products. Like, you can have the period cups or the period panties, which, in a long term can help save money. But some
Yeah.
oftentimes when I talk about this with Black women, they don't even, it's getting better, but they didn't even know that that was an option for them, right? They're like, wait, what is
No.
that? What is
No.
that? And how
Yep.
does it work? Right. So it's access
Yeah.
to information. And that could go back to whether or not their providers are even presenting this information to all of their
Mhm.
patients, right? So
Mhm.
providers not knowing themselves. So there's a like a just a knowledge barrier that could exist, right? We have younger doctors coming in, but what about the older doctors who may not be aware that, they have period cups and menstrual cups and how they work, right? So
Right. Something else, you just made me think of it. I wonder if I have a theory. I wonder if there are cultural norms in the types of period supplies that we are drawn to.
I
So
yeah, I would
you
think
think, yes?
so.
Okay, I have a
I
theory. What's yours?
Yeah, I mean, I would think that Black women tend to stick with, what their parent or mother figure presented, right? So that would be the pad most often. That's what most people are familiar with. And then
Yes.
there's like tampons, of course. I think, with the Gen Z newer generation, just because they have exposure to more information. So they're learning about the different options. Like there's pads, there's tampons, but there's organic pads, there's
Yes.
organic tampons, there's washable
Yes.
tampons, there's period cups, period discs. So the information is getting out there. I think we have to overcome. There's like always an ick factor, especially with the period cups and the menstrual discs. There's an ick factor. So it's like you got to touch it, you got to reach inside, you got to like empty blood and touch blood. So there is an ick factor, which you have to get over if you're going to use these products. But in terms of sustainability for the planet, it's better. In terms of like money wise, if you buy a cup, it lasts for years. Whereas you have to buy like tampons and pads every month. A cup can last for a couple of years. So yeah. What are your thoughts on that?
I would agree. I would say up until a certain age, pads are definitely the norm in the Black community.
Yeah.
And I don't even think it has anything to do with the actual tampon. I think there's probably some stigma around inserting something into the vagina before a certain age.
That's very true.
Which is a whole nother conversation. So yeah, like I don't think I used my first tampon. I was a pads girl until prom night because of course I had a yellow chiffon dress. And what better time for my period to come, right? Senior prom,
perfect timing.
Yellow chiffon dress. And I was timing. Like, and I was inexperienced with the tampon, and I had read the the little pamphlet inside the Tampax boxes and saw the graphic. Remember the graphics that's on there, and it shows you how to insert.
Yeah.
I had read that, but no experience before senior prom in high school. And I think like most of my friends were using pads, not tampons, pads. And even today at, late 30s, a lot of women that I know still are not here for tampons, let alone some more innovative or newer things like the Diva Cup or the menstrual disc or anything alternative. It's like, nope, not sticking anything in there.
That is very true. Yeah, you're absolutely right. You're right. Like it could be just like some generational thing. So I know that I was only introduced to like cups and because I had to work in that area, and then I had a doctor and I worked with adolescents, and so she was very innovative and like, look what I found. And I'm like, what in the world is that, and how does that work, right? So I had to learn how to use this so I could teach my young adults, okay, this is another option for you, type of thing. But I am a Diva Cup girl. I use all menstrual discs. I haven't used oh my gosh, I couldn't tell you the last time I used a pad. Occasionally I'll use a tampon, but there's pros and cons to everything. Nothing is not better than the other. It just goes back to comfort, but just knowing, I want people to know that there are more options out there and are available to them.
Absolutely. Even the, not to harper on tampons, but even tampons with an applicator versus without.
Yes, very true.
Is a big thing, right? That's a big thing.
It is a very, very big thing. Yes. Oh my God.
The first time you have to ask your friend or your sister or cousin, do you have a tampon? Because we all have to do that at some point. Oh, Flo showed up on me. Do you have a tampon I can use? And then somebody hands you that little piece of cotton, and you're like,
what am I supposed to do with that?
What is this?
How does this work?
Yeah. But once you're used to it, then, at least for me, then the applicator starts to feel foreign versus, so everybody has their preferences. But I do think there are some cultural norms in the Black community that make us, gravitate towards certain menstrual supplies, for sure.
I would agree with that.
Yes. So we talked about body literacy, self-advocacy, challenges in the healthcare system. What steps can individuals, healthcare providers, and the community at large take to promote a more inclusive and empowering approach to reproductive and sexual health? Specifically for Black women, that was a lot of words, but in essence, what can we do to make reproductive health better for Black women?
So, like we talked about, that health literacy is always number one. So, I'm going to always start with that. I think as a patient, you want to do your research about any like procedures or medications. Of course, we want you to use those sites, or, if you're going to take it from social media, people that are like well trained in this area. So
Yeah.
to gather your information, you want to use like the big sites like CDC or American College of Obstetrics, or follow people
Mm-hmm.
on whatever platform who are specialized in this area. I think it's always good to ask for clarification. So if a doctor, nurse, whomever is presenting information and you don't understand, because we tend to use a lot of like medical terminology and lingo, it is okay to ask for
Yeah.
clarification. We should be able to present that information in a way that you understand. So never feel like you should accept information if you don't understand it, and never feel like you can't ask questions because it's our job to clarify, to make sure that you understand what you're getting into or what medications you're getting.
Right.
I also think that you shouldn't be afraid to be difficult, right? I know for myself, we always have that difficult patient, and that difficult patient is usually the one that's asking a million questions, or is not afraid to rock the boat on
Yeah.
something. And that makes for a better patient. It makes for a better health experience, just because you are getting
Yes.
everything you need to know to make an informed decision, because that's what you want to do. You want to make an informed decision. And then in terms of the healthcare system or healthcare providers, I think we need to do a better job during the training. So like in medical school, nursing school, PA school, whatever, just to kind of infuse more information about like the disparities, and probably maybe some history about why this disparities exist for specific to
Yeah.
reproductive and sexual health, so that they understand kind of when they're making clinical decisions, or a patient is presenting a certain way, why that's actually happening. I think it's important for a provider to take a patient-centered approach when they're dealing with their patients. And what that means is that you, as the healthcare doctor, is not telling the patient what to do. You're giving the patient all the information. You're providing all of the different options. You're telling them the pros and the cons about those options, and allowing the patient to make a decision that's kind of best for them and their lifestyle. As a
Right.
community, I think that it's important that, how can I say it? I think that we need to address maybe like coercive policies. I think like in a system wide,
Yeah.
like you can look at the healthcare system, you can look at state, you can look at local, you can look at federal, just addressing those policies that are kind of outdated, that really impact reproductive and sexual health. So,
Mm-hmm. Okay. All right. You hit them all, and I hope that when people listen to this, they hone in on that piece.
yeah.
Ask questions.
Yes.
We get into the room with the doctors and we clam up, and some doctors, they might not be receptive to your questions. So what? So what? If you can argue in the comments and get about it with people,
You
you better ask
definitely.
your doctor some questions.
Right. And I always think it's a good idea to go into any type of clinical situation with of course, questions are going to come up, but if you have a list of questions when you go in, it makes you feel
Yes.
more empowered to ask those questions. The doc may be in and out, because that's, the way that healthcare set up, they want to be in and out. Use the nurses,
Yeah.
use the MAs, because if the doctor doesn't have the time, the nurses and the AMA, that's our job, right? We have to answer these questions. If we don't know the answer, we're going to ask the doctor, like, patient X wants to
Yeah.
know ABC. And so it's the doctor's responsibility to give me the plan of care for you. So don't be afraid to ask the questions. Use the rest of the staff to ask your questions too, if the doctor is kind of in and out, or if you've forgotten something. So yeah, definitely ask questions.
Yes. Another avenue too, you mentioned the PAs, the physician assistants, the nurses, electronic health records, like My Chart. There's a
Yes.
lot of other ones out there, but My Chart is the biggest one. They have a specific button in there. If you go to send your doctor a message, just like sliding in their DM, it has non-urgent medical question right there.
Right there.
Put your questions in there. I use it to talk to my PCP. Hey, and I ask my PCP all sort of stuff. If I am thinking about trying a new vitamin, guess what? My oncologist and my PCP. Hey, is it okay if I do this? I don't really need to get in my car, drive to the doctor, schedule a 15-minute appointment with them, spend a bunch of money. They can usually answer a lot of our questions through My Chart. They can do it from their cell phone, some of them, depending on which
Yeah.
health system they're with. So that is another avenue that I feel like is underutilized.
Yeah. And you're right. It's a lot quicker to get a response. And most physicians prefer that just because when they are working in, their setting, their clinic, whatever, they don't have time to kind of like stop in the day to answer those questions.
Yeah.
So, or you don't want them to be rushed when they're giving you an answer either. You want like a comprehensive answer. So put your question there. They will see it. Nursing staff, that's our job, to make sure they see it, make sure they answer. And so they have the opportunity to kind of like sit and think about the question you're asking, looking at your health, your health concerns or considerations at that moment, and give you the best answer specifically for you. So you don't want a generic answer.
Yeah.
You want the answer that's best for you. So if you put it there and give them the time to like think about stuff and think about all of the ailments or medications or whatever's going on with you, they can give you the best answer. So yeah, you're right. It is underutilized. And
for sure.
Secret, like there was a specific time frame in which we have to answer those questions. So when you put it in there, the clock starts ticking. So
yeah. Yes, it does. Yes, it does. Well, this has been great, Janelle. The information you gave and provided today was phenomenal. I haven't touched on reproductive health in quite some time, and your perspective and your angle is different than any other guest that I've had on before. I can't talk today, but it's late in the day and the sun is not shining, so that might be what it is. But let's get into some rapid fire questions. Are you ready?
I am ready.
Okay, the first one. What does wellness mean to you?
Wellness to me means giving my attention to all of the different areas of health so that I can maintain my quality of health.
I love it. I love it. And a rapid answer. That doesn't usually happen.
I had to think
all right.
about
Why is Black health literacy important?
So Black health literacy is super important because I think it gives my community or people a chance to better take control of their health and their well-being, right? And it helps us to make informed healthcare choices. It improves communication with your providers. It helps us to advocate for ourselves so that ultimately you have good health outcomes and a good quality of life.
Okay. I like that. And last but not least, how can people connect with you, learn more about you, your work, everything that you have going on?
So you can find all of my wonderful musings on my website, thenursenote.com. You can follow me on my social media, Instagram, TikTok, Facebook, whatever else, at the Nurse Note. So,
all right. Thank you so much. And I will put a link to your website and socials in the episode description when this airs. So people can just go there to click and they don't have to search. And I thank you so much for coming on today and sharing your expertise.
Thank you so much for having me.
All right.